Okay, page 732, we are going to talk about the ovaries. The ovaries are the primary reproductive organs of the female body. They produce estrogen and progesterone. Estrogen in the female sex hormone is secreted by the Graafian follicles of the ovaries. Progesterone is secreted by the corpus luteum in the steroid hormone. Let's talk about the testes. The testes are located in the male scrotum and produce the male hormone testosterone, which is essential for the normal growth and development of the male accessory sex organs. Let's talk about the placenta. The placenta is a spongy structure that joins mother and fetus and provides a blood supply between the two. Present only during pregnancy, it acts as an endocrine gland by producing estrogen, progesterone, and HCG. Let's go over to the professionalism box. Under the lifespan on that same page, it lists the child information and adult. For the child, most of the structures and glands of the endocrine system develop during the first 3 months of pregnancy. Keep in mind, it's the first 3 months of pregnancy that this develops. Thymus gland. The thymus gland is the cavity of the mediastinum in both the anterior to, that's in front of, and superior to, which is above, the heart. The thymus gland is also discussed in the chapter Immune System. So if you have any additional questions, you can go to that one. Let's flip over to page 734. Let's talk about diseases and disorders of the endocrine system. There are several diseases and disorders of the endocrine system that would be very beneficial for you to sit down and take a look at. I want you guys to keep in mind the hyperglycemia is having an excessive amount of sugar in the blood. And the hyperthyroidism, it's a condition that results from overactivity of the thyroid gland, and that can also be called Graves' disease. Let's talk about Addison's disease. In Addison's disease, the cortex of the adrenal gland is damaged, increasing the production of the adrenocortical hormones. Etiology of the disease is far from reaching a cause that can be linked to infections such as HIV or TB. An autoimmune attack, tumors, those could either be cancer or benign, or a hemorrhage in the glands. The use of anticoagulants, those are those blood thinners, are linked to the disease. Although this disease is rare, it does not discriminate and it can occur at any age and affects men and women equally. If you guys take a glance at page 735, these talk about procedures and diagnostic tests related to the endocrine system. Good information for you to take a look at, especially when you're out in the field. What type of procedures and testing that may be done. I'd like you guys to flip right on over to page 736. We're going to go right to diabetes mellitus. DM. It's the body is unable to produce enough insulin to properly control blood sugars, that's that glucose level, or is unable to properly make use of the insulin that is produced. We need to know that insulin is a hormone produced by the pancreas that converts sugar and starches into energy that the body needs. So again, we take those sugar, we take those starches, and it turns it into energy. There are 3 types of diabetes. We have type 1, type 2, and gestational diabetes. Each of these have different etiology. Type 1 diabetes is formerly known as insulin-dependent diabetes mellitus. The abbreviation for that is IDDM. Type 2 diabetes, formerly known as non-insulin dependent diabetes mellitus, that is NIDDM. NIDDM, formerly known as, would be the type 2 diabetes, is the most common form of the disease and is typically associated with obesity. Healthy blood glucose levels is usually listed for under 100. With the gestational diabetes, it's a form of diabetes that develops during pregnancy and results when the body is unable to make or use enough insulin to meet the requirements for both the mother and the growing fetus. Let's talk about some signs and symptoms. Classic signs and symptoms of diabetes is polyuria, which is frequent urination, polydipsia, which is excessive thirst, and polyphagia, which is excessive hunger. Those are good 3 ones. Treatment for type 1 diabetes requires lifelong insulin treatment. The most common form of insulin treatment is through the daily use of subcutaneous, which is the fatty area that's located under the skin for your injections, which you guys will be working on this mod. Some patients are able to use an insulin pump, which is a computerized device that is implanted and delivers insulin to the body when it is needed. Let's flip over to page 738, and we're going to go right to hyperthyroidism. Hyperthyroidism is characterized by the elevated thyroid hormone levels. Graves' disease is an autoimmune disorder and the most common form of hyperthyroidism. So Graves' disease is part of an autoimmune disorder and is part of the hyperthyroidism. Signs and symptoms for hyperthyroidism include nervousness, heart palpitations, frequent bowel movements are the main ones. They also have restlessness, tremors, sweating, menstrual changes and weight loss, and changes in the fingernails and hair that can be thinning or brittle. Hypothyroidism is a thyroid that produces inadequate amounts of thyroid hormones. The etiology surrounding hypothyroidism involves the thyroid gland becoming overstimulated, resulting in the constant need to compensate and release more thyroid hormones known as hormones. As this occurs, the thyroid may enlarge and a condition known as a goiter develops. If you guys look down below on figure 31-12, that is a goiter. It is a huge lump that can swell. The most common cause of a goiter is by Hashimoto's thyroiditis, which itis is inflammation. We need to know what cardiomegaly is. Cardiomegaly is enlargement of the heart. Can also occur with that, but you'll need to know cardiomegaly is enlarged heart. Myasthenia is a rare, life-threatening condition characterized by tiredness, extreme lethargy, intense cold intolerance, and an eventual loss of consciousness. It occurs when the hypothyroidism is left untreated for a long period of time. Initial signs and symptoms tend to be subtle and include fatigue, decreased concentration, intolerance to cold, constipation, loss of appetite, muscle cramping, stiffness, and weight gain. Treatment for this is typical treatment for hypothyroidism involves the daily use of a synthetic thyroid hormone such as levothyroxine. Okay, this can also be known as Synthroid or levothyroid. And I believe that's it.